Good afternoon. So I would like to thank you first, the organizers, for inviting me, and all for being here to discuss this very hot topic regarding the new approaches in regulating psycho-emotional state. My field of interest is pharmacology, and particularly neuropharmacology. So I will look on perspective of as pharmacologist on this field, and my mission today, starting this scientific session with this first presentation, is to emphasize the power of our brain. So it is operating by many neuroactive substances. So they are shaping our emotions, our cognition. They are determining whether we feel joy, whether we feel fear, or we are on pain. So brain is balancing all these active substances to operate fully healthy. So now I would like to share my presentation, and let me know if you can see it on the screen.
Yes, we see your slide.
Oh, great. So as I started, so our brain is a highly active organ, and it is carrying this all very neuroactive substances, starting from neurotransmitters, these classical neurotransmitters, active neuropeptides. So those highly active molecules, they play a vital role in transmission sensory, motor, and integrative neuronal signals. So they give this essential ground to our emotions, to our memory, to movement, to sleep patterns. So an imbalances in neurotransmitter levels, they can lead to these disruptions in brain function, leading to various neurological, psychiatric, and neurodegenerative diseases. So what I would like to start with very important neurotransmitter in our brain. So that is gamma aminobutyric acid. So that's our primary inhibitory neurotransmitter in central nervous system. So it's widely distributed across the key brain regions and spinal cord as well as retina. So we have two main receptors, GABA A and GABA B, and we know that GABA A receptor is very important here to mediate anxiolytic effects. And benzodiazepines work on this receptor, and they are used to treat anxiety disorders and epilepsy and sleep disturbances, as well as muscle relaxant in anesthesia. However, as neuropharmacologist, I always have to mention both sides, and as well here I will just make points that we also have to see that some side effects which can come from mechanism of action as well, and also specific side effects for each substance as well are present. But here we see that with benzodiazepines, we have some limitations when we use them in anxiety, and also for other disorders, for instance, for depression, we can combine them with neurodepressants not used for long, since they carry a risk of tolerance, dependence, and withdrawal symptoms. For some patients, more specific, for some maybe less, and still others, some side effects are present here that can lead to even cognitive issues. And next, what we have, and it's also a powerful system in our brain, is opioid system. And we have our own opioid, endogenous opioids, and we have receptors for them, and of course also exogenous substances, the agonists, which can also bind and stimulate those receptors. For instance, specifically, we talk here about me receptor and various exogenous opioids, for instance, morphine and others, which are used as a medicine to treat a very severe to moderate pain. So for short term, very effective. For long term, there of course might come some issues which can lead to physical dependence, addiction, and of course overdose and respiratory depression. Additionally, here, of course, we talk about the brain as a whole system, which different neurotransmitter systems, neuroactive, highly active substance systems, they communicate with each other. So here as well, I would like to go to the next and mention that additionally, the opioid and dopaminergic systems are very closely interconnected cellular levels and influencing disregard and addiction pathways as well. So dopaminergic system, motivation system, and also reward system, very powerful system in our brain and very powerful substance here is operating the dopamine. So it's playing a critical role in various neurological and psychiatric disorders. So here we can mention schizophrenia and antipsychotic medicines, which acts on dopamine receptors as antagonists. But we also know that they can cause some side effects, such as extrapyramidal symptoms for newest psychotics, weight gain, and metabolic disturbances. And there are also medicines which are used for Parkinson's disease, and they need to increase dopamine levels in nigrostriatal system, and those are dopamine agonists. But here we have opposite. They can cause nausea, drowsiness, and psychosis. And in between both, so here, those stages, schizophrenia and Parkinson's disease, we have addiction pathways, so reward pathways, and also here, cocaine and amphetamine and others, those who enhance the dopamine in those pathways may give side effects, which are anxiety, cardiovascular side effects, and others. So endocannabinoid system as well is present here, and there are so well-known endocannabinoids which play a key role in neuromodulation and being quite well described. And the last years, many research articles are on exogenous cannabinoids. And here I would like to mention also cannabidiol. So, and we know that it helps also good for specific disorders, for instance, neuronal hyperactivity in seizure disorders like Lennox-Gastaut and Dravet syndromes for very small children. And of course, it's used and have beneficial effect in combination therapy. And here we also have this highly psychoactive substance, THC, and we know that there are some limits. If we talk about medicine, it has to be below some certain percentage for us to see it as a medicine. And now there are research going on to find what are the benefits using it, which indications could be the best, which patients could benefit of those two active substances, but also what are risks, what are side effects here, and what are contraindications. So which patients experience more those side effects than others. And now we are approaching to serotonergic system and its role in central nervous system. And we know that serotonergic system role is very huge. So starting from major depressive disorders, post-traumatic stress disorders, anxiety, schizophrenia, obsessive compulsive disorders, substance use disorders, and there are several groups used. with the first mentioning here selective serotonin reuptake inhibitors, those antidepressants, and of course as well tricyclic antidepressants. And there are different variations of reuptake inhibitors, for instance, involving serotonin and noradrenaline as well, and also dopamine can be present. But as well here, not everything goes so smooth. And we know that the first point is that effect from those medicines are starting quite slowly. It might take several weeks, even more than months, for patients to see the effect. And not, of course, everyone is willing to wait and can wait so long. And of course, there are also the side effects coming and remission coming. And that was leading the last years more to find active substances which can give this fast effect, and leading to shift in the research for depression therapeutics in favor of this rapid-acting compounds. For instance, esketamine, that is one of the mechanism of action is working as NMDA glutamatergic receptor antagonist. So, and here we have some restrictions, of course, for it first, and it is chosen when some previous treatments are failed, then there is an option to use esketamine as well. And now, I think more than 5 years, it's already on treatment in Europe as well, maybe even more. So we see that it's for adults when they're treatment-resistant depressive disorders with indication, and also in acute short-term therapy for rapid relief of depressive symptoms in adult patients. And here the main side effects are cessation, hypertension, and others usually are reported as going and awake quite soon in a one day. So similarly, recently clinical trials has suggested that serotonergic psychedelics derived from various natural sources. So they rapidly alter the mental states by acting on serotonergic receptors. So here we can mention several ones, psilocybin and others, which all are studied and reported quite a lot the last years. So psychedelic compounds, they induce profound changes in perception, cognition, and emotions. And in recent years, there have been huge interest in their therapeutic potential as well. And we look at preliminary clinical trials. So they suggested that medically supervised psychedelic-assisted therapy might be effective for instance, treatment-resistant depression, post-traumatic stress disorders, substance use disorders, anxiety, and others. So additionally, there are promising results published and observed in managing cancer-related anxiety disorders. And however, of course, we need more evidence on this, and so further clinical research, of course, is necessary to establish as well as safety and long-term effects and optimal therapeutic applications. So when we look on a mechanism of action, then of course there is not only one direction and they work just on receptors. So we see that there are several directions and different ones as well for different substances. For instance, psilocybin, it is reported that it's increasing neuroplasticity and neurogenesis, working also on brain-derived neurotrophic factor. And also, there are reports on mammalian target of SMIM pathways. For others, we see that presynaptic inhibition of serotonin transporters and also vesicular monoamine transporters are published. The research on that. So we see that there are also some differences between those active substances as well. So what is interesting here that we also talk about is intracellular serotonin receptors here in this field. So with serotonin that is binding on cell membrane, but its unmethylated amino group restricts its membrane permeability, and it cannot really normally access intracellular receptors. And so we're looking on those psychedelic substances that they can also, with this methylated group, they can increase this membrane permeability and activation in intracellular receptors on different organelles. So by these psychedelics, they lead to most rapid enhancement on structural neuroplasticity. So this also could be interesting for me to hear from other speakers. So what they think about this mechanism of actions, how it is for serotonergic psychedelics, what gives this fast effect, how do we differ them more from other substances, and of course how they differ from each other as well. So psychedelics show promising efficacy in treating this depression, anxiety, and many studies have been published, and we can find them in PubMed and other databases. Very many on psilocybin and also on other active substances as well. And among these, psilocybin demonstrate very rapid, sustained therapeutic effect. But of course, it will be interesting to hear from speakers what they see in their maybe clinical practice. So how they can discuss these differences as well here. And other substances as well, they're showing benefit for this mental disorders and mood disorders treatment. So of course, further research is needed to compare the long-term efficacy and safety in different psychedelics in this mood disorders. So not to exclude, of course, safety considerations, we always have to talk about that as well. And what we can see that, and I also will show that there are different those psychedelics. They are coming more substances which give even different effects and more toxicity. And this is it cannot stay the same for all the substances. And if you look on, for instance, there on that California study, which reported also the increase in emergency departments visits and hospitalization. But of course, we have to speak and see what substances there were. There were many reports on ketamine and other substances. On side effects, the most which can be found in clinical studies reported are headaches and some disrupted senses, can be some nausea and poor focus. But in generally, most studies indicate that psychedelic therapy has not resulted in serious or life-threatening adverse effects. Of course, as I mentioned, we need to gather more data and to show for which patients and which dosage and for which disease a certain substances the best. So having a look, what do we have in those psychedelic market and what we can choose, and we see that we have those tryptamine class, which are widely known, so certain energetic psychedelics, and then we have those novel synthetic variations. With actually about them, we talk that they can give more toxicity and they in stimulant effect are compared to tryptophans, but they are more challenging and also unpleasant, intense psychological reactions might appear. And there are also other issues coming with those new substances that very often they are also mislabeled and falsely sold as other compounds like LSD, DA. So there is a risk of unpredictable and unwanted effects. And so this is, again, a situation which calls for more attention. But to conclude, and for further discussion on regarding serotonergic psychedelics, so they are seen and now already described as good assistance, therapy assistance, and effective for post-traumatic stress, for substance use disorders and treatment-resistant depression, and maybe other states will be later covered. So we have also published clinical studies, what we can see, and observational studies. So still we don't know, of course, everything about neurobiological mechanisms, and also most probably not clear picture maybe about undesirable effects when we talk about very specific patient types. And from my point of view, the better what we need is to find the dosage to see the most effective compounds for specific and certain diseases, and this optimal clinical management, and also to look at gender bias and age and optimal duration of use, as well to understand what are contraindications where we don't need to use them, and that can cause a potential risk. So most probably the safest and also most efficacious treatment protocols are those who will be existing and made in combination also with psychotherapies. So this is open for discussion, and this is my story, how I see it as a pharmacologist now, and I will be very glad to see and hear what other speakers will tell us and how do they see this field now and in the future. So thank you for your kind attention.
Thank you so much, Professor Jansone, for this very nice overview on substances that affect the central nervous system. And we have time for one question. Then probably I will ask you, Wim, do you have some thoughts about it?
I'm very happy with this overview. It makes me a little easier to join you, because it shows, I think, that we know quite a lot about the effects now, but the mechanism of action is really difficult. And do you think that because we see now promotion of combination of pharmacotherapy and psychotherapy in these treatments, will we ever find, does that actually complicate our studies into the mechanism of action?
Yeah, thank you for your question. Most probably it will be a bit complicated, but research is not easy, you know, and yeah, it might be difficult to distinguish what then is what and what gives the most effect. But if there will be a comparison, maybe we can find, yeah. So it's not easy question. I think I will not give you the right answer. Yeah. Thank you for question.
But just to continue this question, are there any trials comparing psychotropic drugs with some psychotherapy, head to head?
There are definitely psychotropic drugs comparing with psychotherapy, but there is no study so far that's comparing one of the psychedelics with psychotherapy and without psychotherapy. So the question whether psychotherapy is needed with psychedelics is an unanswered question.
Okay.
Yeah.
So thank you very much for this very nice introductory lecture.